Oh my goodness, I'm so thirsty. We have a lot to get through today. I think I underestimated how much information I wanted to put into this video, and so we might have to make multiple parts. Hello and welcome back to my channel. If this is your first time here, my name is Sydney. I'm a perinatal athletic therapist and postnatal fitness specialist. On this page, we talk all things perinatal, whether that's preconception, pregnancy, or postpartum. We talk about lifestyle, exercise modifications, therapy, pain management, all those kinds of things. And currently we are talking through my personal perinatal journey because I am almost 20 weeks pregnant. And so I am kind of taking you guys through everything that's happening during my pregnancy, kind of like week by week, things I've experienced, things I didn't expect to experience, all those kinds of things. So if any of that sounds interesting to you, please subscribe and stick around for a while. Okay, we have a lot to get through today. As you saw from the title of this video, this is going to be all about pregnancy exercise. Within the topic of exercise during pregnancy, there is so much information and so many bits of information that are skewed, and there are misconceptions, and there is just so much information that is put out onto the internet by people who don't truly know the information and the research behind it. And there's a lot of fear mongering in it too. And so my goal with this, like I said, there's so much information. I can't possibly put all of the information about pregnancy exercise into one video. My goal of these few videos, I'll do a couple of them, is to provide you with some form of information in regards to what you want to work on during pregnancy when it comes to exercise, the things that you should maybe stay away from, how to modify or how to know when to modify your exercise, and just to give you a little bit of comfort surrounding the idea that it's okay to exercise during pregnancy. There's a lot of people who think that you shouldn't ever train your core, that vigorous exercise is unsafe, that resistance training is unsafe, all those kinds of things. And I'm here to tell you that it's not as scary as people make it sound, and it's a lot less complicated than people make it sound too. I just have my tablet here of all the information that I want to cover today. So if you see me reading down, that's what I'm doing. I will also show you, as I talk through the exercises that I personally did through my first trimester, I will put them up here, a video of them up here, so you can see what the exercise is and how to go through it. I will also put below in the caption a handful of perinatal fitness people. They're of all different backgrounds of education, educators, we'll call them. Just a handful of the ones that I trust the most, the ones that I give their information out the most to a lot of my patients, the ones who perform and preach evidence-based research and information, and the ones who have really fantastic programs for people who are anywhere throughout their perinatal journey. So just so you know, this video is not to give you a full like workout plan or like do these 5 exercises and you'll be great through all of pregnancy. These are going to be the exercises that I personally worked on and why it's important to work on these parts of the body and the different things throughout pregnancy that I did, if that makes sense. So we're gonna start with a little bit of background information about exercise during pregnancy to begin with. Now, you may be wondering in the first place, why is exercise during pregnancy even something that you should be doing? Recent research has shown us that resistance training specifically has a ton of benefits for pregnancy. And I'll list off a few, but I'll also tag the article below. Exercising during pregnancy has shown many benefits, including decreased risk of higher infant birth weight, so keeping that birth weight lower, decreased risk of gestational diabetes or ease of management of gestational diabetes. If you have been diagnosed, exercise can help you to manage your blood sugar, your blood glucose a little bit better. decrease risk of cesarean sections, can alleviate and prevent common symptoms during pregnancy, such as fatigue, back pain, symphysis pubis dysfunction, pelvic girdle pain, etc., etc. Now, it's also important to note that none of these things are guaranteed. I've seen posts on the internet that say something along the lines of, I had the best labor and delivery experience because I did X, Y, Z, or did these exercises. It's important to know that there is zero guarantee to a perfect labor or decreased birth weight or any of those things. These articles show us that it decreases the risk for a lot of different things. So just keep that in mind as we go through. There are 3 main areas of exercise throughout pregnancy that we want to focus on. This is throughout the entirety of your pregnancy, and based off of where you're at, how you're feeling, the exercises you're comfortable with, the exercises will change within each of these sort of sections, but these are the 3 most important things. If you do nothing else, work on these 3 areas throughout pregnancy. These are the 3 main areas that I focus on while I am treating my patients, while I'm prepping them for birth, while we're doing prehab for postpartum, all of those kinds of things. The other good thing is that a lot of these exercises are really great for postpartum as well. So if you practice them during pregnancy, if you get really good at them during pregnancy, typically that muscle memory or your ability to do the exercise carries through to postpartum. So you typically have a much smoother transition into postpartum exercise following as well. And the other thing I want to note too is anytime I say lumbopelvic, I am including the core and the abdominal muscles. Our lumbopelvic area is kind of anywhere ribs downwards towards your pelvis and then into your hips as well. So anywhere 360 degrees from your ribs down to your pelvis, your abdominal muscles, your back muscles, your obliques, all of that good stuff. So the first area that we want to work on throughout pregnancy is lumbopelvic and hip mobility. Mobility means we are increasing the range of motion and the flexibility of our joints and allowing our joints to move as they should. This is really important as our body continues to change throughout pregnancy to avoid restrictions in our joints, as well as to allow for mobilized joints during labor and delivery. Now, I'd like to mention something else here. There's going to be a lot of like little things that remind me of other things that I need to mention. You have something in your body, a hormone called relaxin, that happens during pregnancy. It peaks between 12 and 18 weeks. Okay, so you have about 6 weeks where this relaxin really peaks. This relaxin goes into the ligaments and the collagen in your joints and allows those ligaments to be a little bit more lax than they were previously. This allows for later in pregnancy, as your body continues to grow, as we get towards labor and delivery, it allows for a bit of extra movement within the pelvis to allow for the baby to exit and to also allow for there to just be room for the baby to be inside your pelvis. So keep that in mind as we go through, that there is that hormone relaxin that allows those ligaments to be a little bit more lax. When we're talking about lumbopelvic and hip mobility, I'm not talking about that we want to be able to like do the splits or that we need to really increase the range of motion of our joints. We need to essentially just make sure that both sides are moving as they should, that everything is moving evenly, and that you are continuing to allow your joints to move as they should. If we don't allow our joints to move as they should and your body continues to grow, you can end up with a lot of restriction in the joints and a lot of imbalances from one side versus the other in your pelvis. So we just want to allow for movement to be happening there, and that becomes really important as we get closer to labor and delivery. We need our hips to be mobile, we need our pelvis to be mobile to allow for that movement of baby out of our pelvis. Now that brings me to my next point, which is number 2. That is lumbopelvic and hip strengthening. So we have the mobility part. We want to make sure everything is moving as it should. Then we need to make sure that we are strengthening, up those muscles, that we're activating those muscles to support those joints. This is important as our body changes to support our changing joints. Our shift in the center of gravity, which is going to shift forward, allows us to maintain stability throughout our core, throughout our pelvis, throughout our hips, and to maintain muscle mass for postpartum. We have a nice smooth transition into exercise and back to our regular activities and movements and everything that we did during pregnancy or even pre-pregnancy. The strengthening is really important. We want to make sure we keep things activated. I'll put a picture up here of sort of the front and the back of our lumbar spine and our pelvis. We actually have cross pattern activations with our muscles that keep our pelvis nice and stable, and it creates something called a force closure in the back and the front of our pelvis. So strengthening these sort of cross patterns will help to decrease things like symphysis pubis dysfunction, like SI joint pain, like low back pain, like all those kinds of things. So we want to make sure that we are maintaining that force closure throughout pregnancy, especially with that setting in of relaxin. We want to make sure that we're maintaining that force closure so that we can prevent discomfort later on. And the very last section that we want to focus on is pelvic floor lengthening and strengthening. Now, I say both for a couple of reasons. It's extremely important to make sure that you can relax and lengthen your pelvic floor, because that's where your baby exits out of. Your pelvic floor needs to be as relaxed and as lengthened as possible as baby exits to prevent things like tearing. But we also need to make sure that we are still strengthening our pelvic floor, because we are gaining a lot of weight, particularly in our middle section where our baby is growing and gravity is pulling straight down onto the pelvic floor. So that can help to avoid things like pelvic organ prolapse, like round ligament discomfort, like pelvic pressure or pelvic discomfort. So we want to make sure not only are we lengthening the pelvic floor, but we're also strengthening the pelvic floor. Now, this does not mean doing 1,000 Kegels. That's not what that means. It means allowing your pelvic floor to fully relax and then allowing it to be strengthened and kind of following sort of a rhythmical breathing along with the exercises that you're doing. We're not going to sit down and just do 1,000,000 Kegels like this all day long and think that that's helping our pelvic floor, because it's honestly not. It's a lot more complicated than that. I've talked about all of this in a couple different videos. I can tag them below. There's going to be a lot of things. There's going to be a lot of things written below. But I have talked about that in a bit more detail, so please feel free to check that out. I've talked about a couple different things in regards to that in a few different videos. It's important to allow the pelvic floor to lengthen, as that's what's needed for birth. Sorry, I'm just reading off my notes here. It's also important to maintain strength in the pelvic floor as gravitational weight increases downwards to avoid things like pelvic organ prolapse, round ligament discomfort, and prevention of symptoms postpartum. As we enter into postpartum, a couple things can happen. You can have a hypertonic pelvic floor, so a pelvic floor that's not able to relax, or you can have a really lax pelvic floor, which means it doesn't have as much strength as it should. So practicing both during pregnancy can be extremely helpful postpartum. Okay. A couple points I just want to note before we get into the actual exercises. You can begin exercising during pregnancy. Let me say that again. You can begin exercising during pregnancy. There's a huge misconception that you cannot exercise during pregnancy if you have never exercised during your life, or that you don't exercise regularly. You can begin exercising during pregnancy. Period. Or you can resume what you were already doing. If you were weightlifting, if you were doing CrossFit, if you were running, if you were playing badminton, if you were playing basketball, it doesn't matter. You can resume doing all of your activities that you did pre-pregnancy during pregnancy. Now, that being said, This is also really important to recognize. There are very few exercises or types of exercises that you can't do during pregnancy, but this is different for everybody because everybody's history is different. Everybody's capabilities are different. Every pregnancy is different, okay? The key is you're comfortable with the exercises you're doing. You're able to do the exercises properly and maintain intra-abdominal pressure while you're doing them, okay? So you have to be able to do the exercises properly. If you are, let's say, squatting 250 pounds prior to pregnancy and you try it during pregnancy, and let's say even for the first little bit, you're doing perfectly fine. Then after a little bit, you're noticing I'm having a harder time with either lumbopelvic or hip stability. You notice maybe you have a bit of that doming in your core muscles. That's when we want to start to dial things back because you're no longer able to do that exercise properly. And the third thing is you need to be able to modify the exercise if it's not working for you. If you are unable to do the exercise properly, if you're not comfortable doing it, and if you cannot modify the exercise, you need to stop doing it during pregnancy. Not that it's unsafe to do during pregnancy, it just means it's not right for you. I hope that was clear enough. This is where a pregnancy-specific practitioner can come in handy because they can walk you through exercise modifications. They can treat you as an individual and make sure that the exercises you are doing are the right exercises for you to do, rather than finding a blanket program on the internet, doing that program and feeling uncomfortable while you're doing it, not sure if you're doing things properly, or maybe it's just not an intensity that you like. It might just be a little bit toned down from what you used to do or you want to be able to do. Okay. That's all the exercise background stuff. I told you this was going to be a long video and we have a lot to go through, but I wanted to make sure that I gave you a really good background first before we got into the rest of the video. I also just want to put a massive disclaimer here. The biggest disclaimer that you've ever seen. What I'm saying in this video are things that are evidence-based, and they're also things that are not specific for every single person in this world. So just because I've said it in this video does not mean that it 1000% applies to you, okay? Every single pregnancy is different. Every person is different. Every person has a different medical history. Every person has a different injury history. These are all things that need to be taken into account when it comes to exercise, period. Not just exercise during pregnancy, but exercise, period. So when we add pregnancy on top of that, there's also an additional risk that comes along with everything, right? These are things that I teach my patients, and I teach them on an individual basis. So I go through each of these things with each patient individually and apply them to their life specifically. And the exercises I show you are going to be exercises that I have personally done. You might try them and you might hate them. It does not mean you have to continue doing them. You might try them, you might feel uncomfortable, you might feel dizzy, you might have discomfort. That just might mean it's just not the right exercise for you. So please take everything I'm saying with a grain of salt. Okay, let's talk about first trimester exercise. So for myself personally, I am a weightlifter. Throughout my first trimester, I did not go to the gym. I don't even think maybe once. I maybe went one time and I did a very, very, very light lift, I think. I was super nauseous. I was very fatigued, and I was not interested in going to the gym. I just met myself where I was at and I wasn't comfortable with going, and so I didn't. Now, knowing how important exercise is during pregnancy and being someone who teaches people how to exercise during pregnancy all the time, I kind of compiled a really, really short, 10-15 minute exercise regime that I could work on every single day in bed or on the couch. These are things that I could do in a lying down position, in a seated position. They were very low impact. They were body weight, unless I decided to add weights to it. But I just wanted to focus on some lighter exercises and still keep things activated as much as possible. I have a dog, and we went for a WALK twice a day. I said that just now because he's having a really good nap and I didn't want to wake him up. saying the actual word, twice a day. So we go for a 10 to 15 minute one in the morning and then 20 to 30 minutes in the afternoon or evening. And so I was still doing that every day. And sometimes that's all I could do. And that's perfectly fine. That's just what my body could handle. So I just compiled, like I said, a really small list of exercises that I could work on that kept my core activated, that kept my glutes activated, that kept my pelvis and my lumbar spine and my hips nice and mobile, and that maintained my pelvic floor relaxation and activation. For the first section that we talked about, the lumbopelvic and hip mobility, I did 2 different exercises. The first one is a cat-cow exercise. If you've ever done a yoga class or you've ever done any sort of mobility class, or sometimes they even add it in at the end of like workout classes, this one just allows for rotation to happen within the lumbar spine and the pelvis, and a little bit into the hips too. Just allows all the muscles surrounding to just move and be stretched, and allows the joints to move and be stretched. And so this was my first and favorite one. I still do this one every single day. It feels really, really nice to stretch out my belly, especially when I go kind of up into a cow. So that's the first mobility exercise, is a cat-cow. I recommend this. I actually prescribe this to every single pregnant patient I ever see because we can only use it. It's honestly, it's so good for you. It allows everything to lengthen. It allows your pelvic floor to lengthen. It's just so good for you. It's also a great one to do postpartum. The second mobility exercise is a 90-90 hip rotation. So this is a seated exercise. You can allow the knees to rotate back and forth. You can do this in a seated position on the couch. You're just not going to get as deep of a stretch here. I won't go through modifications for this exercise. So if it is feeling a little bit tight for you, just do it on the couch, like sitting on the couch and then with your feet on the floor, and allow those hips to rotate back and forth. And the third mobility exercise that I worked on is just a deep squat. This is actually very comforting position for me in the first place. And so dropping down into a deep squat allows the pelvic floor to open, allows the hips, it's a hip opener. It allows the pelvis to move a little bit too. So this is a really good one. This is also a birth prep position, and it's a great exercise that you can continue again into postpartum. Okay, then we move into lumbopelvic and hip strengthening. This is the biggest section. There's definitely a lot more here that I wanted to work on. So the first one is just a bodyweight squat. Now, I did say that most of the exercises are seated or lying down. This one is the one exception. So a bodyweight squat, squats are extremely important to be able to do throughout your lifetime, regardless of what's going on. And so I just wanted to maintain that mobility. I actually coupled this one in with the deep squat. So I would squat from a standing position down all the way. And with this deep squat too, you can also kind of sway back and forth. You can rotate the knees in. That just allows for a little bit extra movement within the pelvis and the hips. For all of these exercises, I did approximately 10 reps. If I was feeling really good, or if I just wanted to keep going, I would do more. And there was some days where I tried an exercise and I was like, this one doesn't feel good. I don't enjoy this exercise today. This is not something, it's a little more strenuous than I want today. I'm feeling a little bit more fatigued. I just didn't do it. There was a lot of flexibility in the exercises I was doing. The next strengthening exercise is what I call a quadruped pillow press. And so that's on all fours. Essentially what you do here is you have a pillow underneath one of your arms. As you push your hand down into the pillow, you're activating your core at the same time. So you're pulling that belly button up towards your spine along with your breathing. This is really important. All these exercises are done along with your breathing. So we want to maintain, like I said, that intra-abdominal pressure. So as we push our hand down, we're exhaling and we're pulling that belly button in. The next one in the strengthening category is I just call it a lean back with a pillow squeeze. Some people call it a reverse Nordic lean. Like, there's lots of different names for it. So essentially what you do here is you're on your knees and you hold a pillow in between your hands in front of you. You inhale, and when you exhale you pull that belly button in, you squeeze the pillow, and you lean back. So you're moving on your exhale almost always. Then we have dead bugs. Dead bugs is one of the most versatile and core activating, and remember we talked about that cross pattern in the front. Dead bugs is amazing for that cross pattern in both the front and the back, depending on how you do the exercise. So I just did a full dead bug. There are again a million modifications for dead bugs. I'm not going to go through any of them today. I have talked about them on social media before. I think I've actually done a YouTube video. Maybe I'll tag that one below. So this one's incredibly good for you to be able to do. This one's also extremely challenging. I will tell you that. I've done this one for years and years and years. I often do it weighted as well. So I'm quite proficient in this exercise. You may not be. If you are not, please modify. Like I said, one of the criteria, if you cannot do the exercise properly, you can't maintain that intra-abdominal pressure and you can't maintain that core activation, it's too difficult for you and you need to modify. The next one is a glute bridge. I did mine actually weighted, so I just used an 8-pound dumbbell. Glute bridges are super good for that cross pattern in the back, kind of across the glutes. And it's also just great to keep the glutes activated. So I did my glute bridges. These are fairly straightforward. I feel like if you've ever worked out, you've probably done glute bridges or hip thrusts of some sort before. And then the last one in this category is just an adductor squeeze. So putting a pillow or a ball between your knees. I did this on my back. You can do this in a seated position. Essentially just squeezing that ball in between your knees on your exhale for each rep. There are also modifications you can do for this one. You can do this one sideline. You can couple this exercise in with a lot of other things that you do. So you could do this along with a glute bridge. You could also, with your glute bridge, do like a pull out of the band. There's all kinds of different things that you could do. Like I said, I'm not going to go into all the modifications. There's just a million. It would be impossible for me to list off every single modification, so just keep that in mind. And then our third section is our pelvic floor lengthening, relaxation, and activation. I've done a full video on this before. I will tag that video below. Please feel free to go watch that video because there's a lot more detail in that video about how to do this properly. This is something I do on a regular basis while I'm sitting at work, while I'm lying in bed, while I'm cooking, while I'm brushing my teeth, while I'm walking. Like I practice this all the time. It's something that can take a very long time to learn if you've never done it before. So please give yourself some grace when you are learning this. But this again is where a pelvic specialized practitioner can come in really handy because they can coach you through this. So those are all the exercises that I have done throughout my first trimester, just to maintain, like I said, those three things: pelvic, lumbo-pelvic, and hip mobility, strength, and pelvic floor relaxation and strength. I just wanted to give you guys a little bit of a background of what I've been working on, some of the things, some of the major points that we should probably touch on when it comes to exercise during pregnancy. I will do one of these for second trimester as well. I'm in my second trimester right now and I've gone back to the gym. I'm lifting a couple days a week, still walking regularly. I do exercises with my patients every day. So I am staying very active. If you guys have any questions at all, if there's anything specific that you'd like me to go through in more detail, please let me know. Put it below, write to me on Instagram, whatever works best for you. I would like this to be as informative as possible and as uplifting as possible, and to just let you know that there's a lot that you can do during pregnancy and it doesn't have to be so complicated and scary. Like it can just do what you're used to and what you're comfortable with, and you know, you can modify as you go. Thank you for watching this video if you made it all the way to the end, and I will talk to you guys soon.